So I want everybody to have a better understanding of what the vet is talking about when you're in your vet appointment. I want you to have an understanding of the basics, the very basics of how the organs work, what the kidneys do, what the liver does. We forget as veterinarians that most of us didn't know any of that before vet school either. Before vet school, I didn't know what the liver or the kidneys do, or if you can live without them, or if they're damaged, is it really, really bad or a little bit bad? I think I knew that the liver was associated with alcohol problems, but I didn't really know anything about anything. And I can't really teach you all that because it took 4 years of vet school to learn all those things. But as veterinarians, whether it's the emergency clinic or the neighborhood vet with your annual exam, or even holistic vets like me, we get so accustomed to talking about certain organ systems and certain blood work values, talking about them all day, every day, they become second nature to us, and we forget that you don't know what those things mean. So I think the best way I can help you have a better understanding of what your vet's talking about, and to help you be able to communicate with your vet and to know what's happening with your pet in the appointment, is to help explain these things to you. And I think the best way to do that is to look at the tools the vet is going to use. Look at the things the vet is going to discuss. They're going to discuss blood work values and x-rays. So I need to kind of explain to you what each blood work value indicates and give you the basics of x-rays so that you'll have a little bit of an understanding of what your vet's talking about. So that's what we're going to do with Vet Medicine 101, Veterinary Medicine 101. We're going to go into those things. We're going to talk about each piece of blood work. There's usually 20 or 30 things on the blood work that your vet's going to do. We're going to talk about all those. And in talking about each one of those, you'll learn a little bit about how and why and what each organ's doing. And that'll just give you a base of understanding when you're talking to your vet, okay? We're also going to do a little bit of X-ray 101, maybe a little bit of contagious disease and VACCINES 101 when we get there. But we're going to start with the blood work. That's the most common thing. And the prime example I have is, I see it all the time. I've probably mentioned it before. You have an older pet losing a little weight, not eating as well, just not doing as well. And they're older, so it's not a big surprise they're not doing as well. But you either take them to the emergency vet for not doing well, or it's their annual visit and their annual blood work. And your vet comes back in the room or calls you and says the renal values are elevated, or they have high renal values. Well, we forget that you don't know what any of those words mean. Unless you're in the healthcare field or self-educated about physiology and biology, you may not know what renal means. Renal is just the medical term for kidneys. So that means there's a kidney problem. But we said the kidney values are elevated or high. Well, you don't know if high is good or bad. The higher your bank account is, the higher your bank account is, the better. The higher your score in some sporting event is, the better. So when we say they're high, you don't know right away that that's bad, because elevated kidney values are a bad thing. And we forget that you don't know that, and we just go on talking about it, and you have no idea. So I need you to understand renal means kidney, and high kidney values are a bad thing. And this will just get more confusing as we go because, for example, red blood cells, when they're low instead of high, is a bad thing. That's anemia. And we'll explain a little bit more about that later. We don't want to get too far into that right now. So we need, there's more to it than that. A little bit, the kidneys are important. And you maybe know that you've seen some people on dialysis in the hospital or something, or some family members, but you don't know really what the kidneys do. They have something to do with kidney stones, urination, hydration. You may know that, but you don't really know what the kidneys are doing. You don't know what it really means if these numbers are high. What does that indicate? You need a little bit more understanding of that to understand what's happening with your pet and what to do about it, and to know where to go to move forward. So I want to help you to have that understanding when the vet's talking to you, to know what they're talking about, at least at a basic level. Again, we don't have 4 years of vet school to go into all of it, but I think we can cover some basics here, okay? So that's what Vet Medicine 101 is going to be about. And the first little section is going to be the basics of the 20 or 30 items that are on the blood work that pretty much every vet clinic does for your annual visit or for when your pet is sick. Okay? Thanks.